All right. Hello and welcome back to Coffee Time with me, Dr. Suarez, your host at Behind the Scenes 941. I know I didn't forget about you guys, but my face was attacked by mosquitoes and I was trying to spare you from all the bumps. But I'm over it and we're just going to move on because it's been a little while and I wanted to get on to the next part, okay? So a couple things that we've talked about. We first talked about chief complaint. So when the patient first comes into the office, we talk to you, get to know you, try to see what your goals are, what it is that you're looking for. We met my mom and we went over the fear factor, okay? So why a lot of patients stay away from the office, things that some people are fearful of. But in the end, the goal is to get you to healthy, right? To get you to where you want to be and to where you need to be. So moving on, the next part now would be the exam. So I actually have to take a look to make sure that whatever it is that we're building on is a good solid foundation, okay? So this part that everybody hates where we like radiate you and poke and prod you is important. What are we looking for? Well, I'm looking at the gum tissue, the bone, you know, we take x-rays so that we can see. But aside from that, your mouth tells us so many other things. We can tell when something's out of whack just by looking in your mouth. What are some of the things that we look for? So, you know, diabetes. If diabetes is out of control, you're at risk for more infection and more bone loss. Autoimmune diseases can be seen in the mouth. Of course, cancers, all kinds of cancers, whether it be bone cancer, metastatic cancer, tonsils, throat, tongue, those kinds of things. And these are things that we don't just find in people that smoke, right? It can happen to anybody. So those are some of the things that we're looking for. You know, we can see nutritional deficiencies, vitamin deficiencies, there's a lot of things, fungus, all kinds of things that we can find. So one of the first things that we do when you come in is, of course, a full head and neck exam. We're looking at everything, making sure all your nerves are intact. Something as simple as opening your mouth and your tongue goes over to one side can be very significant. So we look for all of these things and we poke and prod you and radiate you so that we can look at your gums, of course, and your teeth and check to see if you have cavities and all of those things. Now, once we do that, of course, we give you a laundry list of like all the bad stuff that we found, but that's not really what we're trying to do. We just want to know, okay, in order to get you from where you are now to where your goal is, what are some of the things that we need to take care of, all right? So bringing it back to my mom, because we've been following my mom, that's the case that we're working on right now. When she first came to me a couple years ago complaining about discomfort on the upper right, she had been seeing her dentist pretty routinely. She had been getting her cleanings pretty routinely. She's always struggled with a little bit of gum disease. And for those of us that don't really understand gum disease, we'll get into more detail about some of the specifics of these things later because I don't want to bombard you guys with too much information. But basically the diagnosis for having gum disease is you have a little bit of bone loss, okay? So, you know, yes, inflammation in the gum tissue and that sort of a thing, but you've lost a little bit of bone, so maybe your gums have receded a little bit, and there's different levels of it. So this is something she's always struggled with. Her home care is good. She does a good job brushing, flossing, goes to the dentist every 3 to 4 months. And all of a sudden she's complaining about discomfort in between 2 teeth on the top. And she's telling me, I just want to stick something in there. I feel like I need to clean it out. So I was like, all right, well, something is wrong. And I bring her to my office, because at the time we weren't living in the same city. So I bring her to my office. All I did was take an x-ray and she had a big infection that had been growing there slowly, you know, from the gum tissue, and it affected not just the one tooth but the tooth next to it, and we actually ended up having to take those 2 teeth out, clean the infection out, and eventually she had some implants placed. But these are some of the things that we first look at when you come to see us, because for the size of the infection that she had going up into the sinus area, she really wasn't having a lot of symptoms aside from like, there's an area that's really bothering me, I feel like I have something in there and I really just want to clean it out, you know, to an infection that could potentially go into the sinus and into her brain. So something as simple as an x-ray or the poking that we do, all those little numbers and the measurements that we do, taking a measurement of that area would have showed, again, we'll go over this, 1 to 3 is normal, but would have showed that there was more than 10 millimeter depth where the instrument just went all the way in. Imagine it's like you put your hand in your pocket and you're feeling at the seam and all of a sudden you notice there's a hole and your finger slides right through. Same thing, we would have noticed that something was wrong. And so, you know, we went ahead and took care of the infection, but we'll go over in a little bit more detail as the videos proceed what exactly we look for. So some patients have gum disease, some patients have cavities, some patients don't have either one, some patients have both. We need to go ahead and make sure we take care of that foundation before we start building, because if we start doing, you know, her crowns and her 2 front teeth and she's got a big infection going on here and ends up at the hospital, then we're not doing her any kind of service. Alright, so welcome back. I promise I won't take so long with the next video, and see you guys soon.